you've gone to the hospital for, let's say, an elective induction, you're there for a really long time, you can leave. Okay, that's what we're talking about today. If your labor is taking a really long time, you're not medically required to be in the hospital, even though they want you to stay and they don't want you to leave, you can leave. So today we're going to talk about why you can leave, why you would want to leave, like why, if you're in the middle of labor, why would you leave? And what the hospital's deal is about not wanting you to leave. I'm Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a midwife and family nurse practitioner.
So we're talking about you're in the hospital because you chose to be there. Okay, we're not saying there was a medical emergency and you had to go in and you need to have your baby soon, okay? The majority of women are at the hospital because they chose to be there for, in this scenario, an elective induction. Mm-hmm. You wanted to be induced, you agreed to it because your doctor suggested it, but there was no medical reason. And so kind of walk us through what's a real common scenario, how these inductions will play out that when they take a long time.
So it could be an induction, or let's say you think you're in labor. Okay. So you go into the hospital and let's say for the induction, they are doing maybe misoprostol, they're doing Pitocin, they're doing Cervidil, they're doing a Foley catheter, trying to get you started. And you've been there for 24 hours and really no changes have happened.
Or not much.
Right, very, very little. And you're getting exhausted and tired, you need to sleep. So you think, oh, should I get the epidural? But things don't seem to be progressing. And they're like, oh, if things don't start to progress, we're gonna have to do a C-section. So let's talk about why they want you to stay and they won't discharge you.
Okay.
It comes down to insurance. Because if they discharge you before that baby's born, that 24 hours of using the room, the doctor being there off and on, checking on you, the nurse, the shift those couple of shifts the nurse is covered, none of that gets paid by the insurance. They will only pay if you have your baby. And so they do not want you to leave until you have your baby.
Can they bill the mother for that time that you were there?
Nope, because if they are contracted with the insurance will not let them bill the patient directly.
Right, because you're paying for like a global fee.
Exactly.
You're paying for your birth.
Right.
And if it takes a day here and then a couple of days later, it's still just a global fee, right?
So what is the difference between, oh, I went in because I thought I was in labor and I left? The difference with that is they didn't admit you. You were in triage. They checked you. They observed you for 1 or 2 or 3 hours, but they never admitted you and you went. So they can charge the insurance for that. Mm-hmm. But they can't do an induction in triage. Sometimes you'll get to the hospital and let's say you're 38 weeks, you're 4 centimeters dilated. You thought you were in labor, but then labor slowed down. They'll keep you there even though you could still go another 2 weeks at 4 centimeters with contractions starting and stopping and starting and stopping, but they want to keep you there because they know their chances of inducing you successfully are pretty high. And so now they have a medical reason because you're 4 centimeters, you're 38 weeks, whatever the issue is. And so they don't want you to go home. They're like, hey, just stay and have the baby. We'll admit you. And it's just easier for them because now the doctor can kind of be like, ooh, it's kind of scheduled in a way. I don't have to be up all night.
Okay. So why would a mother in this scenario, let's say it's an elective induction or she went in and it looked like, yeah, this is going to go. So she did get admitted. Why should she leave? Why are we telling you? You can leave the hospital.
So if an induction goes on quite a while, every hour that it goes on, your chances of a C-section go up. Whether it's because of what they say, failure to progress, or fetal distress because of the Pitocin forcing your body to have contractions, which can stress the baby out. But in the end, your chances, or it's just, oh, this is just taking too long, because remember, they're also looking at the bill. They get paid the exact same amount whether you walk in, are admitted and have your baby 10 minutes later, or you walk in and have your baby 3 days later. It is the exact same amount. that they get paid. Now they can get a little bit extra here and there for a little more for a C-section, or a little more for a vacuum delivery, or a little more with an episiotomy, stuff like that. But in general, they get the exact same amount. So let's talk about doing aversion when your baby is breech and they're going to manually kind of rotate the baby. They do not want you leaving the hospital without you having a baby. So if they do the version and it works, so they flip baby head down, you can leave the hospital because they will pay for it. The insurance will pay for the version because that procedure was successful. So they'll pay for it. But if that version was not successful, they won't pay for the bed and the doctor's time. And if they used anesthesia and the nurses and the medications to relax the uterus, they won't pay for any of that. So for them to get paid, you need to have your baby. So that's why if baby won't rotate head down, then they go straight to a C-section because they want to get paid. It has nothing to do with the health of their baby and the health of you or anything. It has to do with, well, I'm here, it's office hours. I'd really not like to wake up at 3 o'clock in the morning to do a C-section because remember, almost nobody in the country will do a vaginal breech birth. It's very hard to find somebody to do that. So they don't want to have you go into spontaneous labor at 3 a.m. and come in when they could have just done it at 3 p.m. the night before or the day before, and they got paid for the attempted version on top of it. So it's financial. I had a mom once that went in and I'll always warn the moms, hey, this is what the situation is. If you want to go home, you're going to have to fight. And I remember this one mom calling me and she goes, it was a success. And I can't believe I'm saying this, but I'm leaving the hospital without a baby. I'm still pregnant. And she was so excited that it worked for her. But she was also willing to fight because you don't want to do a version at 40 weeks. You want to kind of do them at 37, 38 weeks if you can when baby's just a little bit smaller. And she said, I'm willing to fight and leave the hospital. But
why? What's the point?
For her, she wanted her baby to choose when it was going to be born, to make sure that it was developed enough and wasn't, even though she was, 38 weeks, what if she would have gone to 42 weeks?
Was her plan to have a C-section if it didn't rotate, or was she going to try to deliver a breech baby?
She was going to try to deliver a breech baby with us. Yeah. And so, but she would
if
like the head down.
So if you are going to have a C-section, anyway, that's your choice. Maybe you don't care. Just stay, have your C-section, move on with life. Exactly. But if you're wanting to try for a breech delivery, which we'll talk about in other videos, I recently shared a successful breech delivery story from one of our mamas. That's when you say, well, it doesn't have to be delivered yet.
Yeah.
We still...
Or the mom knows she'll have to have a C-section because there are no breech providers in her area. But once again, if she delivers at 38 weeks, but she would have gone to 42, that's a baby that's 4 weeks early.
Okay, so sometimes they just want to wait and let the baby develop some more.
Exactly.
Okay, so let's go back to an induction. It's taking a while. They're telling you have to stay. Why do you want to leave the hospital? So one of the reasons is that when you are tired and you're stressed, a lot of hospitals aren't letting you eat real food. This is just making your labor worse, longer, more painful. Especially if they're giving you Pitocin all of this time and you're having these contractions that aren't doing anything. In the first place, guess what? Your body's not ready to go into labor.
Exactly.
And you're trying to force it to go into labor when it's not. So that's where you have a risk of so many more complications because we're forcing something when it's not time, right?
Exactly. Because some women, they go in, the induction, they have their baby 4 hours later. The body just needed that little bit of a push. Compared to the woman that it's been 24 hours and hardly anything has changed and she's exhausted. Now, like we said, it just increases the chance of complications with her, complications with baby, C-section risks, just so many issues.
And so the benefit of going home in a situation like that is, first of all, now you're off the Pitocin. You're not trying to force an induction that's not necessary and your body's not ready for it. But a lot of times just the act of resting and relaxing and calming down and stop feeling like I have to have this baby, I got to get this baby out, that a lot of times can trigger labor to just go in. Or maybe you just need to wait a few more days, a little bit longer, and then you could try again with the elective induction, or you could just wait and see when your body actually goes into labor if there's no medical reason.
Right. If
to
high blood
induce
pressure or something, you know, there's not something that's really
yeah.
vital that we have a baby.
So if you're having an elective induction that is just dragging on and you're not enjoying the experience, you're not happy being there, you're tired, you're hungry, nothing's really happening anyway, you can leave. You can go home, eat a nice big meal, take a nice big rest, you know, depending what time of day it is, in your own bed. Go have sex. That'll help with the process as well. Just relax and enjoy these last few hours, these last couple of days, because that's actually incredibly helpful at bringing on labor or helping it to progress. And you'll also be happier and enjoying your life better. Yep. And the bigger thing is that you're reducing your risks of heading into a C-section, or having vacuum forceps, or getting an episiotomy, or if you're trying to avoid an epidural, your chance of getting epidural is so much higher if you keep forcing labor when your body isn't ready for it. And to be clear, I mean, we said this at the beginning, I should remind you, we're not talking about a medically necessary induction. We're talking about an elective induction where your doctor said, maybe you should induce, but there was no medical reason to do it. Or you even said, could we just induce?
Right.
And he or she said, sure, let's do it, right?
Exactly. Yeah, we need to look at the big picture here. And remember, the hospital is going to pressure you because they have spent a lot of money and time investing in you having your baby, and they're not going to get paid. So they may say things like, well, your insurance won't pay if you leave and come back. You know, anything is possible, but the chance of that is like slim to none. Your insurance is still going to pay. The hospital is not going to be happy. They cannot bill you if you have insurance. And now if you don't have insurance, they can do whatever they want. I will tell you that.
Okay.
But if you do have insurance that is contracted with that facility, they cannot bill you for that because it's a global bill and you were admitted.
And you could always call your insurance if you want to make sure on that, right?
Yep. And so they're going to really push it. Then they're going to come up with medical excuses now. Oh, well, your baby could go into fetal distress. Well, is my baby in fetal distress now? Oh, you could develop an infection. Well, do I have an infection now? If your water's not broken, your chances of getting an infection are basically the same as
any other day of your pregnancy.
Exactly. And so they are going to try to come up with reasons to get you to stay. The number one is they're going to try to scare you thinking that your insurance won't pay. And if that doesn't work, they're going to go into other problems.
Okay, let's talk about breaking the water, because that does change things. So if you're going into an induction and it's taking a while and they say, well, how about we break your water? That's a really important time for you to decide, well, okay, do I want to full on commit to getting baby out, even though things have been going slow and not really progressing? Or would I rather go home? Because once they do break your water, that changes
You're committed.
things.
You're committed. And I tell moms that when the option comes up, if they want their water broken, you know, whatever their reason is, I say, okay, just so you know, if I break your bag of water, you are committed, because the risk of infection does go up. If you are group B strep positive, it goes up much more than if you're a group B strep negative. And the more time goes on. So it's really good to have a baby close to, meaning not much over that 24-hour mark from when your bag of water was broken, either artificially or naturally. 18 hours is usually when we recommend starting antibiotics, because the infection risk, unless, you know, you're pushing and baby's about to be born kind of thing. So looking at the risk factors is a big one. I know there are people that have gone days with their bag of water broken before having a baby. Usually those people are on pretty strong antibiotics or a lot of antibiotics, which I'm not a fan of, but there's a time and a place. This is one of those. But I've also known many moms who have lost their babies or almost lost their babies that have gone well beyond the 24-hour mark because they weren't in labor, so they didn't tell their midwife, or they didn't go into the hospital, whatever the situation was. And there are many women who have gone over and been just fine as well. It's both sides.
But the risk is there.
The risk is definitely there. And so do not let them break your water unless you are adamant that under all circumstances, I am not leaving this hospital until I have a baby. Or even home birth center. Like I said, I tell my moms, if you want me to break your water, I will. In most cases, there's a few times I'll just flat out refuse, but I will do it. But you have to realize you are committed. You will have a baby one way or another in the next, hopefully 24 hours, preferably much less.
Right. So if you're considering you may want to go home, don't break your water yet.
Yeah.
You got to wait.
And they may try to, I hate to say this, they may try to trick you into it because they're like, oh, well, your water's broken. You can't go home now. So we're warning you, be aware.
Like they'll trick you into getting your water broken and being like, even though they knew you were considering going home, and they're like, oh, too late.
Exactly.
That is a little tricky.
It is. It is. Now, can you technically still go home? Absolutely. Once again, it's your choice. You can always go home. But we are telling you your chances of infection have now just gone up a lot because once again, we are all about choice with true informed consent. You've got to know what you're up against. So be aware of that.
Okay, so in another video, we will talk about the risks of an elective induction and all that you need to know about. But our main point here is to let you know that you have choices, and being in a stressful environment in the hospital trying to force labor is counterproductive. It's not in your best interest. It's not in your baby's best interest. And you can go home if you need to have your partner advocate for you because you don't want to be the one dealing with this and convincing the hospital. And also, guess what? They're not going to hold you down. If you stand up and walk out of the hospital, they can't stop you, right?
Exactly. And we do kind of what we call natural inductions at our birth center when the mom who comes in and says, I can't do this anymore. I can't. I can't sleep. I can't eat. I'm miserable beyond belief. Can we try to get this baby out? We don't use Pitocin and all those medications. We use other methods. But I tell moms, if your body's not ready, this won't work. And I have moms that come in and they're like, I am having my baby today. We'll do some of our natural methods to see if the body's ready. And after about 6 hours, nothing has changed. I'm like, I'm really sorry. I'm sending you home. I'm sorry there's not a baby in your arms. It's in your belly still, but I'm sending you home. And they're like, okay, it was worth a try.
Because when your body is ready, an induction will work.
Exactly. So, I tell moms, they're like, can I breast pump? Can I do this? And I'm like, once they hit 37 weeks at least, I'm like, go for it. If your body's ready, you'll go into labor. And if it's not, you won't, and you'll learn how to use your pump, So, but I have moms go home all the time who are like, can we just try it? Can we please just try? I'm so miserable. And I'm like, yeah, but I'm not going to make this happen.
We're not going to keep forcing and trying exactly. Unless there's a medical reason to do so. So that's really different from the hospital who's like, oh, you came in for an elective induction and you are here to have a baby no matter what happens and no matter what interventions we need, even if it's a C-section. We're going to get that baby out. That's not ideal.
No, it's not.
Okay, we're wrapping up. We have a free birth class called How to Give Birth with Practically No Pain. If you haven't checked that out, there's a link in the description in the comments. It will help you have a low pain birth that's smooth and easy and happy as much as possible with all of the different factors of pregnancy and labor. So check that out and watch our next video.